Most countries in Southern African Development Community region continue to face an acute shortage of essential supplies, including personal protective equipment in their fight against the COVID-19 pandemic. At the same time, millions of people in the region are facing food and nutrition insecurity due to prolonged drought, flooding and other economic and social factors. Well, Southern Africa Embrace Foundation is currently involved in helping with PPEs across the SADC region. The international charity organization also aims to eradicate poverty, illiteracy and disease in Southern Africa. The Canada-based organization is planning to extend its footprint to West Africa as well, starting with Nigeria. And to tell us a little bit more about their work and their ambitions, I'm now joined from Toronto by the founder of the SAE Foundation, Sindiso Zemura. Thanks so much indeed for joining us and welcome to the program.
Hi, Peter. Thank you so much for the invitation to have me on the program today. It's my pleasure and honor.
Wow, it's tremendous work that you're doing. I was, just as I was reading that intro there. Let's begin with the work that you're doing on PPEs, because in the region that certainly has been one of the biggest needs that has been identified, and you found a way to help.
Oh, yes, we did. I need to say this first. I would like to just reiterate my thoughts and prayers for the people of South Africa and the continent in general. We all know that we've been affected by COVID-19. And with that, we are hoping that the situation does change with time and get better. Now, in terms of what Southern Africa Embrace Foundation has been doing is we've partnered with partners on the ground across the continent, mainly in Southern Africa to say, as you know, the saying goes, umuntu ngumuntu ngabantu, that basically means that I am because we are. And we did have to change the way we do things because this wasn't the norm anymore. This is something new. This is something different. And I'm sorry, my daughter just walked in.
Let her come.
Yes. And so this was something different and something new for everybody because people had never been exposed to such a global pandemic, which wasn't only affecting the continent of Africa, but affecting the entire world. So with that, we had to move we had to change how we fundraise, we had to change how we speak about humanitarian work and think of, public partnerships, private partnerships, but also working with communities directly, working with other partners on the ground, with governments, intergovernmental organizations. And so at SAE Foundation, we came together with different networks. For instance, for Zimbabwe, we came together with the Zimbabwe, the Zim Thrive network and other networks as well, with schools in South Africa, with other grassroots organizations like the Pahamo Foundation. We've worked with groups that support women because with COVID, what we also saw is that it wasn't just only the threat on the security of people, it was more so the health threat as well. And so from the PPE side, all of these networks came together, or they were working individually, but with other organizations. And together we thought, we, the citizens of the continent, need to figure out a way to be the ones that are at the forefront. But it was trying to get the funding or the assistance from the Western world, or we had to dig deep within ourselves, within the communities, to be able to go to our homes, to our mothers, our brothers, our sisters, to those marginalized spaces and say, here are the gloves, here are the masks. We're to also be where to invent. We saw people coming up with ideas on face masks. We saw people coming up with ideas on how to wash their hands and so forth. So that's what the organization has been doing, basically just working across with different networks and organizations to provide the PPEs to the community and some of them to the government hospitals where there's a bit of a lack.
Do you have any idea how many people you've been able to impact with the work you've done?
Particularly with COVID, we haven't really gathered the numbers, but I would definitely say it's been over about 6,000 people that have been supported through the networks that we have been part of. But if you are relating to just the work that Southern Africa Embrace has been doing, which, by the way, Peter, I need to mention that this month puts us in the 10-year mark of our organization being registered in Canada. And with that milestone, we've worked with over 5,000 people within the Southern Africa region, not to mention about 2,800 children.
Well, let's talk a little bit about what you've been doing over those 10 years, and you've dealt with a lot of issues. I mean, it's almost seems too much when we look at it, but why did you pick those issues? You know, illiteracy, homelessness, poverty, gender-based violence, that kind of thing. What motivated that? And isn't it a lot? Somehow you're managing, I guess.
You may say that it's a lot, but I think that's where, we have to differentiate a calling and a purpose. And you and I had a brief of introduction before we started the interview, and it turns out you went to school with my brothers and sisters. Yeah. I'm sure you would know that my dad was a politician and also he was a giver. He used to give quite a lot. He was a businessman. So I grew up in that environment, in that culture where, I was fortunate to have enough. I was fortunate to go to good schools. I was raised in a very well-up family, but it wasn't the same case for some of my relatives and people that I got to grow up around. And I have to be honest, I really didn't understand. They say charity begins at home, as in why was my father instilling those values of having to give back? But then as I grew older and as I migrated, I moved away from Zimbabwe. I lived in South Africa as well. And then I moved to Europe. I went to the US and now in Canada. And moving to Canada, Canada has a culture of giving back. It has a culture of encouraging people to care for your neighbors, to care for those that do not have. And those are some of the things for me where I took my experiences as a young person growing up in Southern Africa, the thoughts of what some of my family members had gone through. Some of them didn't get an education, specifically to young girls. Some of them had experienced gender-based violence in the hands of their partners, and I grew up seeing that. And some of them, unfortunately, are or were living with HIV, a disease, a virus that was never understood. But in those times, in the 90s, there was so much stigma, discrimination, and lots around it. And so when I found myself in Canada, I thought there are so many opportunities in this country, and I have the space to be able to do something to give back to where I came from. And so we came together with my husband and some of my friends who are from the Southern African region. And I basically shared what my dream was. We wanted to turn this dream into a reality. And with time, we thought, okay, so what are we going to focus on? We knew that we wanted to focus on Southern Africa. And so we chose, having to focus on education. We wanted to focus on helping to reduce the stigma, the discrimination, but raise awareness on the issue of HIV or AIDS. And we wanted to really, again, look at marginalized communities where most of it is really women and girls. And that's where we started. And our footprint has always been in Zimbabwe, South Africa. We are in Eswatini, Lesotho, Botswana. And most recently, in the past 2 years, we partnered with an organization that works with over 1,000 farmers in Malawi, and they support over 5,000 families.
Cindy, I wish I could talk to you for longer, but great work that you're doing, and it certainly does sound like a calling for you. Thanks so much indeed, and don't get tired for doing good. It's really well appreciated. Thanks so much. Good to talk to you.
Thank you, Peter. I appreciate it.
All right, that's Sindiso Zemura, who's the founder of Southern Africa Embrace Foundation, doing great work in Southern Africa to help not just with PPEs, but helping women and children with a number of issues, from education to violence against women.